4 new ones here. A little baby pinch here. I think, yeah, try to get pretty close with that. Oh, sorry.
It's okay.
I know that you've watched me squeeze out thousands of blackheads and whiteheads here on my YouTube channel, but I know that many of you guys suffer from acne yourself and you're just not sure what to use. This is why one of the first products I created at S&D Skincare is my acne system. This is a simple, twice daily, 3-step regimen. It is formulated for all skin types and all acne types. So for those of you who are not able to see a dermatologist or who are just plain confused when you walk down that skincare aisle, you want to go to sndskincare.com and check out my acne system. Because her daughter just had a baby. So wonderful. How many grandkids do you have now?
He's number 6.
Oh my. And you're all pretty close.
They're all under 4.
I mean, they're all under 4? Okay, I didn't know that. That's not what I meant. I meant they're all like live pretty close.
Oh yeah, we all live in the same city. Yeah, it's nice. Great.
And this city is pretty small population, isn't it? Mm-hmm. Okay. You all kind of know each other then.
Yeah.
Well, I'm glad that she's doing well and baby as well. So.
Me too.
But she's exhausted. You've been on like around the clock, so she's kind of loopy today. She's not too talkative. So we're gonna she might fall asleep. So we're just gonna let her. Once I numb these up, we'll pass her a mirror pinch, and she can watch if she wants, or she can keep it on her lap.
Yeah. I do want to watch.
So she's not in a bad mood, because if I didn't say that, everybody would be like, "What's wrong with her?"
Yeah, no, I'm just tired.
Why is she so quiet?
I know, because I'm never quiet.
Yeah. Well, she grabbed the mirror.
Thank you, Val.
If you need to put it down or anything, just let us know, okay?
Okay.
Okay, we have that one that was under here that was a little bit hard to
do look like I have the chicken pox.
Yeah, a little
That's
chicken pox.
Funny. Oh, it's going to be a good one.
I don't know. This one's harder to get to.
Am I in your way?
No, you're not. I'm on my way, but I just don't want to. I can't grab it well enough to.
Because it's in a weird. Yeah. Ooh, I told you it was going to be a good one.
Oh, I woke her up. Wow, you the whole time with me today, you did not get that excited.
Oh my gosh.
It's hard to grab that.
I know, it's in a terrible spot.
Maybe you can grab it. You want to try to grab
Me?
it? Well, yeah, because then you're not scared to do it. Do you want to pinch one of yours? Oh,
sure.
Do you want to? Yeah, you don't have to.
No.
Well, let me get this one. This one, okay. I don't think you can pinch that either, really.
No, because it's weird.
It's not a pinchable area.
No.
But let me just see if I can remove that sac there. See, a little bit more still coming out.
Yeah, I think there's more. It's just in a weird spot.
It's tough to reach under there and get anything here. You're okay there, though, right?
I'm fine. Yeah, thank you.
I'm trying to get this. I always try to get them out of the smallest little hole. I think she told me that 2 of them got a little inflamed this last time. Probably because we talked about it. I know we never really talked about it before in this last.
Oh no, that didn't hurt me. No, I was gonna talk and I had to take a breath.
Take a breath.
It's probably because there were so many, and I know you tried to get the sac out of all of them, and so, but maybe, who knows?
I think it was because there's some next to each other too.
Oh, that too.
That's what we were saying, but that's okay. Thank goodness there's only 2 or 3 or something like that, right? But and that hopefully it doesn't keep happening this time. I'll try to even be a little extra careful. I think we got the sac there. Did it look like it to you? Looks like it. See, I don't know. Some of these, they might come to the side. It's just harder because I definitely had a few that were next to each other the last time. It was fun though.
That was a cool pop though.
Okay, this one you might be able to squeeze yourself. Let's see. Right here, this one. Okay.
Am I in your way, Val?
No,
okay.
You're not. I might probably get in yours.
You can squeeze now.
Okay.
Want to do that? Push down on it. Yeah.
Oh my goodness. Look at that. That's crazy.
And push down on it.
Yeah, go ahead. You can get more than I can.
Oh, look, part of the sac, I think, come out a little bit. Let's see if we can pull the rest of it out. Oh, maybe not.
Whoa.
She's so silly. She's way too silly.
It just blows my mind.
I think that's why actually one of the reasons that people love you, because you actually are enjoying it with everybody else that is watching it. Like you feel the same way.
I'm just so excited that they're like gone. Whoa.
Yeah, it was under there still. Trying to see if I can't grab the rest of it, the sac part. But
oh, neither one of those was the sac. Oh.
No. It's still in there. I love her. It's like she's the, what are the famous like people, the newscast, the guys that do the base. Yeah,
oh my
like
gosh, like Vin Scully.
Yes, you're like Vin Scully.
Yeah.
Vin Squishy.
Yeah, Vin Squishy.
Never have the perfect. I need the perfect. Someone needs to make me the perfect forceps for this.
Oh, I didn't grab that.
No, this is no. I don't think the little ones work very well. Actually, every time I use those, people get mad at me.
They do.
Why are you using those? Throw them away. And I agree too. I'm thinking that's. Oh,
sorry. It's just because it just started to.
I pushed against you with the forceps. I pushed down.
Oh, okay.
I'm so sorry.
No, it's okay. It just started to hurt.
No, I was trying to
that
get
one's
it.
in there.
And trying to get the silly sack. See, that's what I did just now. Those were a little bit pointed. I was trying to push down like this.
Yes.
To push it up. So I could grab it, but it took you by surprise. And then I got shocked. I think I lost. I deserve it. I lost like a year. Oh, there it is. See? God, I almost had it. So annoying.
Yeah.
Oh, that's what I did need. Yeah, I need those. The suture pickup. I was just telling her when she first came in that you look more beautiful. Even though you're exhausted today, you look more beautiful. I feel like because you don't see those areas anymore. And I don't know, it just, isn't it easier? You were just saying when you look in the mirror, it's weird for you to not see them anymore. You were so used to it for so long.
Oh, yeah, forever.
This is like causing me problems now.
It's 25 years.
25
Some of
years.
them have been my friend.
Yeah, you talked to them when you had a down day kind of thing. It's like right here. I see you. I see you. You just don't want to get picked up. Come on now. Let's get this thing. Oh. It's like once I get it, are these like my most effective piece of sutures here? It doesn't want to grab.
Maybe it's really thin.
They are really thin. I know that for sure. But
you taught me that.
Girl.
Do you want the ones with the little teeth?
No, I just want these to grab. And they're not. Do you see how they're not grabbing? Grabbing them.
You can make the hole bigger if you want to.
No, I don't want to. Oh, see, it's like so close. Okay, let me try my other ones. Maybe that'll work. I have like 3 different sets. And these are not cheap pickups either. These are good kinds. I don't know. They're all not, they're like not grabby and they're slippery. That's the thing. It's like the oily, you know? It's like oil on a little piece of fibrous kind of tissue. Girl, I'm getting mad at this one. It's like so close yet so, it's like right looking at me, teasing me. Oh my God, come on. I need something. What do I need?
Super cute. Looks like a little melon, you know?
Yeah, baby melon baller. Now it's not hurting, right?
No.
Okay, come on, let's scoop you out. Doesn't want to scoop either. Seriously, you pain in the butt, I mean. In the booty. Come on now.
Ooh, he wants to stay
He
in there.
He does. You see,
just like my grandson wanted to stay. He didn't want to come out.
Yeah. What is his name?
Maddox.
Oh, Maddox. See,
you got a hold of it.
I know,
I feel it. I mean, I don't.
Tugging
No, I
it.
don't.
Tugging
Yeah, I don't feel the pain.
But it won't. It still won't. See, it's on this. Oh, what? I lost it.
You lost it.
It's like a soap opera.
We just need that music. Dun, dun,
Look. It's still tucked on the side there. Oh, God. Seriously? People are going to start yelling at me. If they would only come in and strangle me over the internet, they probably would.
No.
See, I can't even grab it, even with it's so slippery. Oh, my God. Girls, I'm getting so mad. Look, it's still on the side.
You're just gonna have to cut me more.
I know, but why? Why do we have to do that? Why does that have to happen? Why won't this just grab? Look at this. It won't grab it. It's like some kind of voodoo. Some kind of Seattle system of. Did you see how some people? I thought it was so cute. Some people call this Seattle Tacoma. That's really cute when they call it Seattle Tacomas.
Yeah.
They're my favorite, the Seattle Tacomas.
That's funny. That's cute.
Okay, now we know though it's on this side. Then I need to grab it this way. It's like 10 minutes later, or 15 minutes later on one stinking Seattle Tacoma. It's like when people say, when people change the words, like, what do they say? Shut the front door.
Yeah.
It's like that.
Mm-hmm.
I think I got it then. Let me try and push again. I don't see anything anymore, right? What do you think? You think I got it? Gone. Okay, let's move on. That one was like a
Sorry.
sucked up all our energy.
Yeah.
Okay. Phew. This one.
Mm-hmm.
There we go. You want to squeeze that one, Mama?
Sure.
Let's see. Push one side, push it together.
Oh.
Push down here. I'm doing most of it.
You're
for
doing
you.
no.
That's
You're
not
doing
nice.
good. No, because it's in a weird spot.
Yeah, I thought that was going to be a fun one for you, but no, that's not fun for you to get to. You're a trouble child. I think that kid. This is the Maddox session.
Mm-hmm. Right?
The Maddox session. Do all your kids have little nicknames, or even grandkids? Oh, there it is.
Yes.
Look, there it is.
I give everybody
Oh, you
nicknames.
do?
Yeah. Mm-hmm.
We should get nicknames too then.
Mm-hmm.
To know each other. We get to know each other so well.
All right.
We'll figure out what it is later.
Yes.
You'll let me know. You're surprised. That one was gone. I like that one. That one was complete.
Okay, good.
I felt complete with that one. Okay, let's do this one, and then that's good.
Okay.
With your chest, that is.
Okay.
Yeah, that one didn't get inflamed there. You see that one okay?
Mm-hmm. Whoa, did it already come out?
Yeah, that one's pretty much, that one's very oily.
Wow.
That one's like butter.
The butter one, yeah.
Mm-hmm.
It's so crazy
Usually
how they're
those
all
kind of-
different texture.
There's three, I feel like there's like three or so different kinds.
With me, yeah.
Yeah, like one that's really oily. Then those tend to
is that
come
the
out.
sack?
Mm-hmm. See if there's there it is.
That's so crazy to me.
Yeah, oh, that's a love one.
I was watching the video from last week when you did
There's
all
something else here, I think.
a bunch of them, and I could not believe how many sacks. I mean, it
Yeah.
was just absolutely blew my
That's
mind.
why I think it's so rewarding for people to see. Is that one or is that just fibrous tissue? I think that's fibrous tissue. It's not tugging. I think we got it. Yeah. That one's gonna heal more too. But do you feel better about coming here to have them taken out, or?
Oh
do you
yeah,
take it?
no,
Really?
yeah.
Well, I
You
don't
know why? Because they get a scab, and then it's hard for me to see like what's the scab and what's the.
Oh, you can't have somebody
stitch.
out, one of your other kids that love to be. No,
they
okay.
won't. No.
Do you want me to leave it longer, so that you know? No.
Oh, that might be a good idea. Sure.
I mean, I don't want to leave them like huge hairs coming off.
Oh,
of
I
you,
don't care. Nobody
But
sees
longer,
them. But
I'll
yeah.
do that like this. Okay.
Okay.
How's that? And you can grab one and then pull
Got
out.
it. Perfect.
Okay, it's a deal.
Okay. Good job.
I think that's good there then. This one, yeah, I think those are gonna do well like that. Let me see.
And they know what's coming. It's like
Yeah, it's like building up to it.
the amusement park of pimple pops. You know.
It is amusement park. You should put that. She just called herself the amusement park of pimple pops.
It's like the
It's
jackpot.
here.
It really is.
You are jackpot. Yep.
I can't wait to
Putting
watch
all
it.
dots
It's
here.
new.
Yes, I know. You would wish you could watch these here, but
Mm-hmm.
it's hard for you to do so. Okay, there's one under here. Okay, little baby pinch here, pinch. I might wake you up a little bit here because of this, but you just tell me if anything, you know, if you need me to if you need to put more numbing and stuff like that. These are going to be the
It's so
juicy
funny.
ones, the
It
wet
feels
ones.
like the penicillin shots you got when you were little, when you were
On your tush? I don't remember that, but does it hurt that bad?
I
Does
think
those hurt?
they usually give them to you in your hip tush area, you know?
Yeah, like your like more fatty area. I think. Oh no, muscle. I think it's muscle that we do it in, but in kids, that's where it is. Do you need to get that? You want to get the phone? You think it's your daughter or anything? Let's pass it to you.
We all literally live in the same city.
Yeah, I know.
It's great.
Were you born there too?
No, I was born in Chicago.
You were? Oh, sorry.
No, it's okay. And then moved here when I was 1.
Oh, okay. So you're pretty much raised here.
Mhm.
In that town though too?
No, in Orange County.
Okay. How you're the one that moved there though, and then you moved the whole family, like your mom there?
Yes.
Okay. It's not like your mom pulled you over there or anything.
No. I had two brothers pass away
Oh, I'm
in
sorry.
'06.
Oh my.
4 months apart.
Oh, okay, not related then, but
No,
close
one was 39 and he had heart attack.
Oh my gosh.
And the other one died. The doctor nicked an artery during back surgery. They were both kind of freaky.
Oh my gosh.
And so we moved her to be close.
I see. Now the back surgery, was that kind of just routine almost? Like it wasn't really something that like they had to be, I mean, for him comfort, it wasn't like emergent or anything like that?
No, it was, yeah. He had
routine-ish kind of trying to plan for something.
his discs. He was having surgery on his discs.
Okay, let's start here. I'm gonna start right here. Pretty close.
Okay, I'm excited.
Yeah. Maybe you could just flex and they pop out.
You probably don't have to try real hard. They're all so good. Oh my gosh, I'm so excited.
That one was a good one.
Good.
Nice one. But let's see if we can pull that little friend out from the inside. Yeah, it looks like, I think these ones that are stick up like that and are almost clear colored, those are the ones that come out the easiest.
Was it ooey or was
This was wet, a wettish one. I think these are going to be like that too. The ones that are stick up more.
Yeah.
Because they're really soft.
Right. True.
And they're almost like watery.
Yeah.
See that? Almost. Well, some of that's probably numbing liquid, but they're usually even watery, like more so. I don't know.
You're right. The ones that are squishier,
Yeah.
softer, are very liquidy. There were a lot of those on my
Those are the ones that
in the last
messier because they
session.
just take up a lot of, there's a lot of stuff that comes out of them.
What did you say? Vanilla pudding?
Oh, did I,
think you said
did I
that
say
last
vanilla
time. I
pudding?
don't
Yeah, I
remember.
guess banana pudding, some people
Oh,
say.
banana pudding.
Look at that. That was a good one.
Was it a good
You
one?
did. You have to see it. We'll show that one. Play that back for you. That was the sack that came out. That one gets a 10.
Good.
I hear a little like cracking, like it might be still sack there, but I don't feel anything. That's nice and flat. Look at how pretty that looks. It looks really good.
I have not had
And it's not caved in.
flat booty in years.
Oh, you want a flat? It's like we're gonna have to play that song. Flat bottom girls.
Oh, that's right. That's a good one.
That's not what everybody goes for now anymore, though. I don't want the
know.
flat bottom
True.
anymore.
That's so true. Big booty Judy.
Mm-hmm. There's another good one.
I'm so glad.
Those are very satisfying, I'll tell you. Those raised ones, look at how pretty they look now. Look at how nice the contours of her tush now. You have a pretty nice tush, I will say, too.
Thank you.
And I see a lot of tushes.
Thanks.
I get these all here. Let me see if I squeeze them all right now here. So that we're in sequence here. You okay, right? Ooh,
Yeah, that
no,
one
no,
I
wait.
felt a
Okay.
little bit.
The last one just now? Okay,
Uh-huh.
okay, let me get a puddle of numbing right there. Might have been, I can't now though. There's steatocystoma juice kind of flowing around here. Let me see. Moving that a little bit here. I'll put a little more numbing in just a bit. Let me just make sure these are squeezed out here. Is this hurting you a lot? No?
I don't feel that.
Okay, good.
No.
Good. This is the oil kind of coming out there.
Okay.
That's why. So I'm not doing anything sharp. I'm just trying to
Uh-huh.
clear them out. That was a good one. A little linguine. I gotta give you play-by-play.
Yeah. There you go. You're the commentator now.
I am. I am the commentator. Do you like to listen to me talk when I do? I think you're the person that likes all the same things that all the people that watch my channel do.
Yeah.
Relaxing to hear.
But I like it because you explain everything.
Yeah.
So that people that don't understand, they understand.
Yeah, and I try my best, and I try because you are very normal. You know, you don't want to be embarrassed to come in here. I feel like what were you thinking when you came in here? Were you like, I'm gonna go see her because she's not that far, and I just feel like she won't like judge or she won't.
No, there's
I don't know,
several
like,
reasons why I came. I came because first what attracted me was so many people had similar things that I had.
Oh, yeah.
And then also the way that you explain and you treat your patients. You're not pretentious, you're not arrogant, you're not, because sometimes doctors are great doctors, but they lack bedside manner. But you're not like that, so it was very welcoming and inviting to, You're so sweet. So.
Well, like even with me, like I feel like I can talk just fine to lecturers if I'm giving it to patients. But I feel like because I talk like that, you know, if I just kind of talk it down and I don't try to use big words and things. That
Well, sure, there's
but, you know,
definitely
I don't care.
an
It's me.
audience. You know, I mean, it's appropriate, you know. I mean, of course, if you're sitting around with a bunch of intellectuals.
But I don't have to prove myself either. I don't have to
That's
prove
true.
that I know those words. I don't have to act. I just.
Oh,
Oh, sorry.
sorry.
No, that. Can you feel this?
Yes.
Okay.
Thank you.
It's almost there. It's right there. But I'll put some numbing right under top and push it out.
It's so funny. You'd think because it's on your booty that, and there's so much padding, even though it's muscle, that you wouldn't feel it, you know? But you,
Of course you're gonna feel. You have nerve endings here. I mean, I can't see why you wouldn't. You know, of course you're gonna feel it just like anything else because we have nerve endings in the skin. If you pinch your skin and stuff.
Sure.
I mean, you're tougher here, I suppose. You know where you're really sensitive are like your fingers and your under your nose, your lips. So that is more sensitive. Those are satisfying. Though we got this one already, right? That was the first one we got, right? Okay.
These are so cool.
They're good, aren't they?
oh,
think
you're
we could
making
give
me-
her
now
too.
I'm like
Now
so
you're
excited.
mad. You can't see
I'm
it.
mad.
I'll let you play it a little. I'll play a little
I'm
bit for you.
excited.
To make sure, again, these are new ones I'm pinching, okay? So, two new big ones here that we're gonna squeeze. I like to get the water off so that it comes out like linguine, but no linguine there.
There's so many.
These are still like butter.
It's like jackpot.
It is. It's a jackpot, girl. You won. Well, I won the jackpot. We all won the jackpot.
It's
We
gonna
all
be
did.
so strange to see my booty with
I
no
know.
bump.
You're gonna be wearing thong.
No. No, you know what?
These are satisfying.
Even when I was younger, I never did that.
I don't think many people do.
Yeah, in Europe they do, and that's fine.
Yeah,
A
yeah.
lot of
In
people
our
in Europe
country,
do,
exactly. Not in our
and
country.
that's fine.
Yeah, it is fine.
Mm-hmm.
Brazil too. I think they're.
Greece.
Come on now, let's go. Let's get this one.
I can kind of.
Oh, you can feel this one here?
Uh-huh.
Okay. Let me get that too. Numbing. Pinch again, numbing underneath there. Maybe because I was tugging on that lower little bit. It like makes these little noises like what would you call it? Like spongy noises. You know when it's coming out? Do you know what I'm saying? So it makes this
You know
shrimping
what's
noise.
funny is I don't hear it in here, but then when I watch the videos
Oh,
and people
interesting.
comment,
Nice.
I'll go back and listen, and then I hear it. Yeah.
This is a little blackhead right here. I can get that one out with the comedone extractor.
Oh.
I don't think I've actually had to use that on you yet. Kind of, yeah, I think it's a blackhead. I'll see.
Is
I'll
it
see
a
if it's-
mole?
It's like a dark one. Maybe it's just because it's openness, so it's oxidized a little bit. You know, that's just
Yeah.
exposed
Well,
a little
you
bit. I
would
could
know.
see it.
I wouldn't.
That's a
Clearly, I
nice
can't
little
see
tiny
it.
hole. If I can get it out of this little thing, that's good. Come on. Shouldn't have said that out loud. That says, "Oh, you think you're gonna try to get me out of there? We'll see about that." I know I have conversations with your
That's okay.
Tacomas.
Yeah, it's okay. I have had them too. When I can't get them out when they're inflamed.
That's good when I got it. Okay, this one right here, I think there's a little darkness to it, so it looks like a little blackhead.
Okay.
I'm gonna push against your booty then.
Sure.
Yep, blackhead.
Wow.
Just a little one. You just didn't know it was there. You would have gotten rid of it, but you didn't know it was there because you just had all these other things in the way,
Right.
distracting you. But it was a little one. I think we got off.
Oh, you know what I noticed? Remember I told you I found a few more on my back? There's a couple blackheads like in between them.
Oh, really?
I can't reach them though.
Okay, we'll try to do that for you too. Don't you worry. This isn't the last time we're seeing you either.
Oh,
We don't
no.
finish it.
No.
You know what? We got most of this tush done. At least the
Really?
round of the tush.
Oh no, wait till you.
Yeah, the top. I know. There's the top. I know. We're high. We have that covered up right
Yeah.
now. But there's little ones right here. But I think this is going to make a nice difference because the contour of your tush will be nice. See,
This is just awesome.
You love it? I didn't know you got so
Because
convincing.
you squeeze like on one, but because you're nicking all of them,
Oh,
like
so
they all come out. at the
I
same
nicked a
time.
bunch of them at the same
Yeah.
time.
Ah, so it's like a volcano of.
Yes.
Oh, isn't that weird? Yes, and we're all getting all excited about it. I did that. Oh, this is part of the one that I did just now. Huh? Okay. All right, let's. Gotta lose count of them. So.
My son this morning, he had to go to work today, but he goes, "Are you going back to the hospital?" I said, "Well, yeah, but I'm going to go to the doctor first." He goes, "Dr. Pimple Popper?" I said, "Yeah." He's like, "Oh."
Oh, he's missing it again. You mean?
Yeah. Well, I wouldn't want him to
yeah,
play with
yeah,
it
I
like
know.
me anyway. I mean, I don't
Yeah.
care if he sees the video because it
Yeah.
just shows, you
Yeah.
know. But actually, I probably wouldn't care. He'd be the one that's like, "I don't want to see," you know.
You know what you should do? Isn't he the one that plays jokes on you?
Yeah.
Do you have anything like that you always nag him to do that he won't do? Like if he has to fix the ceiling light or he's gotta, we should put a message or a Sharpie on your booty.
Oh,
Like,
we should.
clean the dang garage.
No, I have the perfect message. He needs to take the C-Best and the C-Set,
Okay.
and he needs to enroll in a credential program.
Okay, let's
Yeah.
put that.
Oh my
okay, I'm gonna
gosh.
write it on a we'll let you
love
write it
it.
on a post-it and I'll put it on your other side of your tush in the picture, okay?
I love you.
Let's
That's
do
so
it.
fantastic.
Let's do it.
I absolutely love it.
So we'll put that in the beginning, like the beginning pictures, okay?
Oh my god, I can't stop laughing.
You know who you are.
Uh-huh.
You take this test or whatever. Let's do it.
That's fantastic. There's a lot of things I want him to do. I try not to helicopter parent though,
But you know what? Now
Sometimes
everybody
they
else is
need-
gonna know, so they're
yeah.
all gonna ask him too.
right?
So,
They're gonna be like, "You need to
have
do
you
this."
done this yet?
Yeah, I love it.
Come on, little ones. These are. I didn't make a big. Oh, ooh, I got it.
Yeah.
I didn't make a big old nick on these, so I'm trying to pull them out of a. And sometimes you just get it perfectly. If you grab it, it comes out.
Good.
They're like little worms, kind of like little sack worms. I don't know how to describe it. Oh, see, I got it too. A little baby neck I made. It makes me feel good when I get it out of something small, because I almost feel like you don't even have to stitch something that small. It's
So
like such
I'm
like a
just-
nick in the skin.
I'm just guessing, but because they were mostly on my bra area where it rubs and where you sweat, you know, and then on my
No, that's it. Okay. One little baby pinch right here. Pinch.
Well, you know how some of us are fortunate to feel like we realize our calling or our purpose.
Yeah.
And I just feel like mine is to be a good role model and for my kids. Just to
Yeah,
be
don't you
there.
feel like she is though? Like
Yes,
she makes it feel so easy. Like it is really hard for me. I think my
is
hardest
hard.
job is being mom.
You're
And
right. You're
You just
absolutely right.
sound like you make it so easy.
No.
You do. You make it really easy. And your kids know you're there for them. You have so many, and you have so many grandkids too, but I feel like they just know you have their back no matter what.
Yeah.
And you just know what to say, and you've raised them. You'd think that so many kids, you wouldn't have the time to pay that much attention to be able to raise them to be good people, but you have, and it looks like you've done it with such ease. Your kids are so well behaved. Everyone that I've met, you know, just you know what I mean. She just
We're
has
just
it.
lucky. We're just blessed.
Just
We're
fibrous
just
tissue
blessed.
here. Cut that out. Like a little pile of tools here. Sharp objects too. I'm trying not to
Get
cut
you a tool
myself.
belt for Christmas.
I know. I need a comedone belt.
You're gonna look like one of the MAC makeup people. You know how they have all the brushes in there?
Pretty good.
Yeah.
Yeah, I'm like a little tool thing. You know what I need? I need a comedone belt. I need like I do need a belt. Actually, I've thought about it before because to hold my what do you call it? The liquid nitrogen that we have.
Oh.
Because we walk around with that little thing. Okay, let me put some stitches in here.
I'm so excited to watch the video.
I know. I'm going to show it to you right after. I'll show you some. You got time.
Thank you for taking me today. I wasn't expecting
Oh, I knew we were going to. I thought we were going to do it. Oh, you were going to come the other day. That's right.
Yeah,
Because your daughter,
she wasn't,
she was not ready. She's not ready to have her baby quite yet.
No.
That kid wanted to. You should call him Stiato or something. Maybe that's his nickname because he cut into your Stiato time.
Yeah.
No, that wouldn't be nice. see. We'll think of a better name for him. I'm sure you'll get one.
Already
Have him
have
do
one.
how is it? Uh-oh.
I call her Maddie Patty.
Maddie Patty.
Mhm.
Oh, well that goes with him. Do you see this little? There's another one right here. I feel it.
Oh yeah, they're all
Right next to this one. I see that little bumpy.
Mhm.
See that a little bit, Valerie? I don't know if you can tell. There's a little bump right here. There's another one to the side. Let's get it.
Yeah.
Yeah, right? Ooh, that one's connected a little. Made it bubbly. Oh, it's because of that. There's a little air in that one, and I just push against it. And it
Was
makes a
that
bubble.
like
That was your booty talking to us. Your booty was talking.
Wow. Oh my goodness, it's so relaxing.
Because they were a little bit kind of connected, but not anymore. It looks like they're okay. Stitch to these areas. So I did talk about in my one of my other videos. Did you see anyone else for this? You did, right? No?
Well, not. So when they would get inflamed over the years, I would go just to
your primary doc, okay.
MD office, and they would lance it and then never stitch it. They would just,
Leave it, yeah.
put a Band-Aid on it and it would go away. But I have seen a couple of different dermatologists over the years that said basically there's nothing we can do.
But they told you what it was, kind of thing. So you knew kind of.
They just said that I had overactive oil glands and that there's no soap, there's no,
There's another one here.
anything that I could do.
Yeah, nothing to make them go away.
Yeah.
But you said, did you tell them, well, can they go away when somebody extracts them?
Yes, I told them when they become inflamed and I have them lanced that they never come back in the same spot. And but no one offered no one.
But you know why.
No, why?
Well, and I think I kind of addressed this in one of my last videos, and I it's good we talk about this because I think people don't understand. They kind of got testy with me, saying, well, why don't you normally, how dare you, why don't you normally remove these? Well, because they're not medically necessary to remove.
Yes.
Sadly, they're not. They're not causing you any harm, and they're so time consuming to do it. And also, the fact is that we don't want to create a scar on you. Like, what if we did this and you didn't like it? You didn't. But you know what? I think no matter what, obviously we're trying to make the smallest scar line possible.
Right.
But I think you're going to be happier with it. Actually,
I'm so happy. I'm so, like I told you, I can't tell you how many times I feel like crying because
I feel
no
like
one
look
ever
happier.
has offered to help me. No one. So So that's what I say when I found you and I watched these videos, I was so.
And then we're so pretty close too,
you were in
which is
California.
awesome.
I mean, I was like, oh my goodness, I need to go see her. I don't care if it takes.
And now look, you're like pretty much part of our family here.
I love it.
When I need to stitch over there.
I absolutely love it.
And the thing is that I think for all those reasons, if I had seen you like 2 years ago, if this Pimple Popper thing hadn't really happened, I don't know if I would have done this unless you were my good friend and we knew each other, and I was like, okay.
Of course.
Because you don't want to, well, it would just be, and if you didn't were my friend, you know how this would be really expensive. And I guess we would, I think as dermatologists, many of us might feel this was beneath us in a sense. Well, not, I don't want to say it like that, but this is such an easy, mindless thing to do, but an esthetician can't do it, though.
Right.
There's like nobody really to do it other than.
That's what I mean. I mean, it was just to find you, it was like a miracle for me. I just feel like.
Well, you know what it was? It really has to do with all these people who love to watch this. I honestly probably wouldn't be doing so many of these if I didn't know people loved to watch this.
Yes.
But now I would be maybe because, I don't know, I realize how much happiness it gives my patients. That was actually one of the little gifts of this, doing this. Right. I realized, then I start to realize, wow, people really, really appreciate when you get rid of these spots. It's not just like, oh, thank you, and they forget about you. I mean, they remember you.
Yeah. How
This is not
because
you don't really think. I guess we're thinking we're life. We try to change your skin and make it more healthy, but we don't really try to. And that's something to be said. That's something that I learned from this. You know that it's more. This is just as important because it is life changing mentally and.
Right. I see what you're saying. Medically, it's not that big of a challenge because it's like you said. It's very.
It's just mine. It's sort of
very,
but. And I'm also creating more scars on you right now. I'm creating to get rid of it. I have to do something.
But you know what?
But it's gonna heal well. I think it's
people
gonna
that
better.
have this, it's so worth
Yeah.
it. It is so worth it. I mean, I don't give it a second thought because.
Pretty good. Wait, one more right.
I mean, clearly, look at me. It's like you. It's almost. I don't know. It's just.
I think this is going to be. I already see the transformation. I don't know. Maybe it's a subliminal thing with you. But when I saw you today, I just thought you were looking, even though you're doggone tired, despite that, because I didn't think you looked tired. I thought you looked really beautiful. And I feel like this is having an actual effect on you that is not really not really tangible. I mean, I know you have less bumps on you, but so you see up here, I'm gonna hide this tattoo. Actually, no, we got all those. Girl, we got all those on that one side. This is your good side now. This is the good side. I'm gonna fill you up because I'm gonna feel if there's anything I feel missing. I don't know. I don't think maybe see one there, but no, I don't think so in general. There's one baby one right here, but there's a couple big. Okay, so what should we do? What time is it, dear?
Oh, it's 12:18.
Oh my gosh. Okay.
In school.
And when you were like gonna interview here or royalty here, we were like, what is that? Like, what are you guys gonna do?
Looking through the chapter in my book, trying to
figure out what it was.
Stuff. Yeah.
Oh, of course you were. You're such a good student and stuff. Did you think that it was gonna be lame, or that it was you didn't know if you were gonna be interested in it, or?
To be honest, I didn't think that I would, but then it got really interesting. Like once I did my first surgery, I was like, oh yeah, this is fun.
Oh, so you like surgeries and stuff.
Yeah.
I would too.
What was your first surgery?
With Dr. Rufus.
What was it? Yeah.
I can't even remember. It was just a skin cancer.
We started a new award. We'll have to put a video of it on this. A little bit slightly depressed, but we'll take a look at those later, okay? Oh, what do we have here, son? Those are wisdom spots, by the way, okay? That's a wisdom spot and a wisdom spot.
What is that? What's a wisdom?
Well,
It was just a skin cancer.
We started a new award. We'll have to put a video of it on this. We started because one of our newer girls that works with me had a cyst that he removed recently, and it squirted all over her shirt.
Yeah.
It did.
And I don't think she was happy with that at all. But she's really, I really like her. She's a sweetheart of a girl. She's a little quiet, but she's very, very funny. She actually speaks, very kind of a dry humor, and
She just pretends to be.
yeah, she does. You're right. She does pretend to be quiet. Well, she doesn't. I never really hear her yell or scream.
She's the funniest, quietest person. She says stuff, but
she only when she says something you listen though, because she doesn't speak them. She doesn't take over a room. Like some of us might chat and speak over each other. She doesn't do that.
Yeah.
But she is very funny. I don't mean by saying quiet that she's shy. She's just quiet, quieter. But she's really funny, and I think that really kind of ruined her day though when that happened. She had to go home. She just took off, right? She took off. She got to go home
it was
the
her
day.
half day anyway.
Yeah. Oh yeah. I wasn't saying she took off and
Yeah.
left us all in the lurch or anything, but she left, and so I didn't see her afterwards. So we gave her a special it's like a huge heart, like a weight, like a paperweight, and she signed it with a date that she got splashed, and so the next person, so she has to keep it on her table. And the next person.
It stays there.
Oh, you pass it on.
Yeah, whoever gets splashed again.
Well, because
the
if
next
it moves,
person.
that means someone else gets splashed.
I know.
So.
Yes. And they have to sign it too and put the date.
That's funny. That's a clever idea.
Yeah.
I know she had to wear it we have old scrub tops here.
Oh, that
she had to switch out and wear one of the old ones.
Oh my God! You know what I'm gonna do? I'm gonna go to the scrub shop and get a really embarrassing scrub top.
Yes, it should say I got splashed or something like that,
well,
and I'm wearing this shirt.
That would be cute. We should get everybody a T-shirt that did that. But it should be something all SpongeBob or something really loud, kind of embarrassing.
Yes.
You have to wear that SpongeBob top.
That's funny.
You're yeah, I got splashed. And we can make it really big so people are swimming in it. And can you keep on attention to the time for me too? Because we should, well, I think we'll be finished with this in time, actually, right? All this.
Yeah.
I think we're gonna take care of a whole tush. If I could get this darn one out. Where's this one?
Today, there's so many inside, remember?
What? What?
Oh, yeah.
What do you mean? Where? No, we're all done with your tush. I mean, we're not done with you totally.
Oh, okay.
I'm seeing you again no matter what, girl. You're coming over to my house for the holidays.
Right? Seriously.
I'm serious. She should be.
Favorite stuff.
You know that we're having our event this next week? You don't have to come at all, but we would love you to.
No, thank you. You were telling me, I think it's next weekend, right? Or this
Yeah.
weekend. But because the baby is
Oh,
coming
yeah.
home
Yeah, we're
and
gonna do a
I
bunch of them here.
missed a week of school.
Oh my
and I have
gosh.
2 papers due. Yeah.
Oh, you were in school?
Mm-hmm.
What? All right, I didn't know any. What are you in school for?
To be a teacher.
Oh,
school.
you're gonna make a very good teacher.
Thank you.
You're already a teacher,
I wish
so
I would have had a teacher like you.
I know.
Aw,
I know.
so sweet. Yeah, I'm excited. So I've missed like
What are you gonna teach? What subjects?
history, high school.
That's your favorite history?
Yes, I
You're
love
such a
history.
cute little nerd. I love it.
I totally was.
Yeah, so I'm excited, but I've missed school. And in college, it's like they're 10-week sessions.
Yeah.
Like I can feel that one.
Okay, I thought maybe you were. I'll bleep out. I'll
Hi,
make
honey.
any kind of phone conversation.
Hi, actually, where am I? I'm getting my booty bumps extracted, literally right now. So did I, but this is fantastic. Yeah, I feel like I'm at the spa. Yeah. Have fun. Okay, how's the baby? How's everything going?
Just take that top of it off.
Oh, they're gonna try to breastfeed today. Yay. Oh, good. What? Yeah, her milk hasn't come in yet. Yeah. Just probably trying to help her latch. Yeah.
Good.
Right.
That's good.
Try to
My
latch
goal is
on.
to get all of these out before we leave today.
Okay.
Well, Christy's still here. I saw her
Oh,
there when I went.
okay. Maybe
Go home,
my
Liz.
friend. Oh, these are annoying me.
Okay.
I feel like I'm a little masseuse to a VIP celebrity.
Okay. Well, I'll call you on my way to the hospital, okay?
Oh my god, come on. What the hell? These are
No,
not
I'll just
satisfying.
on
These
the,
little
more
ones.
like on the inside.
Yeah, they're like stiffer or something. They're not as like watery, you know?
Love you. Okay, honey, bye.
So he doesn't have to work today, huh? He can spend all the time
Well,
or he's trading off.
Well, yeah, we are trading off, staying at the hospital with her, but we have our own business, so
Oh, okay.
yeah, he's
I don't think I knew what you did.
construction.
Oh, yeah, I think you did tell me that.
Oh, crud.
What? You forgot
No,
something
I was
construction?
thinking he has to retest for an additional classification, but that's not till. Wait, what's today?
The fifth, sixth?
I think it's the 11th.
Okay.
Sorry, I lost track of days and time.
Oh, your back looks pretty good. A
Good.
little bit slightly depressed, but we'll take a look at those later, okay? Oh, what do we have here, son? Those are wisdom spots, by the way, okay? That's a wisdom spot and a wisdom spot.
What's that? What's a
Round,
Too
you
bad
missed
we
that
can't
one when it slipped
rewind.
out, yeah. Can't rewind life, but it's okay, you get to see the part that comes out. We had a lot of good ones here. I thought I wasn't gonna get a good one in here because I wanted to give her a Sharpie and she can write that message to her son and we'll put it.
Oh,
We forgot to put it on the side. Oh goodness, yeah, grab that.
Vanden Langenberg.
Yes, that's her. I know, what a name, huh?
Wow.
That's quite a last name.
Kind of cool.
Yeah, it's like it keeps going on. It needs a man on the end or a Vanden
Never
Langenberg.
ending, yeah.
It's like how many
I don't
endings
know
can we
if
put in it?
this Sharpie works. If not, I'll grab
Oh,
it.
I'm sorry, honey.
Oh, no, no, no.
So put something like, I think there's another one under here.
I'm just gonna.
What are you
I'm
gonna
write-
say?
I'm gonna write son. He knows
Okay,
who he
yeah,
is.
yeah.
Oh, I'm excited. This is fun.
This is funny, yeah.
Can I-
Yes, no, sit up. Sit up, and if you're hurting you, let me know. I'm sure you will. Better. It's nothing. So yeah, you keep me though in the time. I think we'll have enough time, right? But you keep me in the know, okay? Because I am enjoying myself too, actually. Weird, we all are. Weird, we're all just staring at your booty and enjoying the day. You're gonna make someone's day with your booty. Did you ever think that?
No.
You're like, you know, like these girls with the famous booties. It's Amber Rose, Black China, and
Right?
Momma Squishy.
Oh my goodness, the whole time she was in labor, it was Black China and Rob for days.
Oh, like that's a show?
Finally, she's like,
So you watched it all of it.
turn that off. She's like, I can't take it anymore.
You know, that's probably no good. She's probably gonna associate that now. Like, she's not gonna want to watch that show
and
because
she
it's.
loved it before.
Yeah, that's so
she
funny.
loves all those shows, you know? And so now she's like, I just so don't even want to
Yeah, because you just associate that now with like all the feeling sick. I know there was something here. I saw it. I think it's on the side. There's another one. Yeah, a lot of these are like little doubles or triplets, so that's what happens. See, they're like right next to each other. See if I can combine that there. Okay, make sure you write it so everybody can see. Everybody can understand. And then what should we do? We should just go We'll scan your back and we'll put that in there. You know, like we're just taking it out before and after. That'll be hilarious. We'll keep quiet about it, see if he gets it. I'm sure he'll get it.
He's gonna die. I'm gonna tell him, don't mess with your mom because you never know what's gonna happen. I'll get you.
That's right. Because he tries to get you all the time, right? This is why we're doing this, for the record, because her son is a sweetheart, but he is a prankster.
Yeah, he
And
gets my goat every day.
Every day?
He just loves to push my buttons because he likes to see me get aggravated because he knows what to.
He knows how to do it. Yes.
Yeah.
Oh, yes, yes. We're on the. What are you need us, or you're glowing?
I'm going.
What?
But we need you.
We need you.
Need anything?
We do.
And you clearly don't. You had it. Come on in.
You
we're having a
no,
party.
these are fun to do, and you can help me cut the stitch. No, do you really have to go? Fine.
Well, I was
Go.
gonna go if you didn't need me.
Well, I just would have needed you like in maybe 5 minutes to cut a couple stitches. That'll make me go a lot faster. You want to do those now? I'll do this right now, and then we go. Or do you not want to say? No. I'll do them right now, and if you get the scissor, I will go ahead and cut. You can just. I'm just gonna cut. I'm just gonna put in a stitch here on these far ones, and you can. So we're playing a trick actually on her son. Her son likes to watch these, but he can't. You know, we don't want him in here because he's her son. We don't want him to like have a front row. Yeah, look, ooh, that's a good one. This is cyst. Look at that one.
Good.
We're so weird here. We're like, oh, good. Get that one on my booty.
Okay.
Aren't we weird?
Procrastinate right. Procras. Is it TINATE?
E?
Okay, so people have to forgive
Look,
my
there's
spelling.
like 3 on top of each other. Look. And they were all different colors. Did you see that, Christy?
They were all
You're
different
not
colors.
kidding. Yeah. They were all different colors here. And that was a cool one, actually. See, they're still popping out of the... I'm sorry, I got sidetracked.
Come out like that. They look so cool.
Yeah, wait. Pushing on her booty here because I can't get that out well. I know you guys want to squeeze too. I should actually let them have a squeeze at you, huh? I should charge everybody for a squeeze.
For pinching her booty.
All right, that one I got to come back to, but I want to make her wait. Now I feel bad. So I'm going to put a couple of stitches here. She's going to cut those, and then she's out of here. Here, let's do them quicker. This will help me because this one was like a double, and it was really raised up. So I'm going to put a little stitch here. What does it say?
I said, son, don't forget
Oh.
that you need to get into a credential program and take the C-Best and C-Sec. Get on it. Quit procrastinating. Love, Mama Squishy.
So what we did is her son always plays tricks on him, on her. So what we're doing is we're playing a trick on him because he
calling
can't
him
watch.
out.
He wishes he could watch this. He said, "Oh, I'll watch it when it's on tape." So when he gets on the tape, we're gonna post that on the tape. So
Yep.
he's gonna be like, "Oh, it's a message to me," calling him out.
I love it.
Oh, so much better. This is. You don't know how much much. I need you, Christy. That one I think is a double under there. You're gonna have little, like, sutures here on your booty, like kind of in the middle here, which will be fine, but just so you know, they're like little pokies, you know.
Okay.
If anyone's stroking your tush, they're gonna feel little bumpies. It's not hair.
That's funny.
Does it smell like fire? No? I feel like I smell like burning something. Like burning wood? No? Okay. So she had a grandson this last few days ago, yeah.
Oh,
But he had some, yeah. He's still in the hospital, but he's doing well, yeah.
Like her
He's
oldest.
oh yeah, that's right. Just like your son.
Do you spell it OX or IX?
OX?
Yeah, she wanted it IX.
Maddox.
Yeah.
Okay.
Oh, I don't think I've seen that before. Is that somewhat common? People do definitely do that?
I don't know. I think she liked it because it's different.
Yeah.
I've never seen it IX.
Okay, I think I'm pretty good there, honey.
Okay.
Yeah, I'm good. Thank you. That was really, really helpful. You cut down, like, seriously, at least 5 minutes from us. No, we got what you got, girl? Yeah, no, it's hard because I gotta. Unless you can stay, then I don't want
She
to
has to
stay.
be out of here in the before 1 also, so
Oh, okay.
just a few more minutes.
Yeah, but I'm in the middle of popping, so she's gonna be able to watch the popping. See, there's something under here. I know there is. I can feel it. Feel this? Where is it? I think it's on this side.
Yeah,
It's like down here.
12:30,
Okay.
just
All right,
so
darling. Thank you.
Yeah.
All right, we'll finish at 12. Thank you. We're gonna finish at 12:40 because then I'm jamming out of here. Okay. I gotta go see that doctor. I gotta get an X-ray on my foot.
For you?
Yeah, I broke my foot. Where is this one?
Wait, you broke your foot and
I
you're
broke my
standing?
toe. Yeah, I'm okay though. It's actually much better now. I just was being a fool. I was trying to jump up somewhere like an Olympian. Girl, I can't get this one. Why can't I get it? Huh? This one's annoying me. This is the first time I've ever not been able to find where it is. I don't wanna. Oh wait, I got it. I felt it. Here we go. No, yeah, a little bit, but that was a sad one. I think I just hit the edge of it. What the heck? I swear I just felt a little pinch. It's like sliding out of my reach. There it is, right there. See, look. But it's like not. It's like I don't know. It's still not all of it. Maybe it's like a cluster of them again. I don't know, but let's try to pull that out. Whoa, that was a crack. Oh yeah, there it is. See, that was a good one. Popped out of there. See,
They're sneaky, huh?
They're sneaky.
Yeah.
They are very
No.
sneaky. See, look, there's an opening right there. I feel like right here, there's something. See that like grayish thing right there? Like it's an opening to one or something. Like a punctum to. And then even despite that, there's still, well, no, that feels better. There's still something down here though, for sure. See this one, even though I went a few times, I still feel like there's a raised area. Maybe.
I feel like I should have got waxed before I came in here.
No, you know what? I'm telling you, you have a really nice tush.
Thank
Like I
you.
said, I see like a lot of tushes. You know how some people, they just naturally don't have any cellulite. It's like a nice color, and
It's white.
we're all admiring your tush.
Okay.
Let's all talk about how fabulous Mama Squishy's tush is. Everybody will make comments now. It is. She's got a nice tush. So we want to show it off. We don't want to have this problem, right? We want to be able to. I grabbed a total pile. See, this is the fun part right here, Christy. Watch. Hear that too? It makes this noise.
That was me again?
Mm-hmm.
Oh my goodness.
That was your tush making the noise.
Still? Same?
Yeah, same, but a different one.
Holy moly.
There, see that noise? It's like it makes a crackly noise.
Yeah.
It's like fibrous tissue, like the
I feel
galea,
saying,
like I said.
Excuse me or something. My goodness.
No, you can't say that because you don't even know what's happening.
No.
That one I can get on top of. All right, since you're still here, I'm gonna put a stitch here, and then you go.
I'm
Okay,
staying
let's do
here
that.
now.
Oh, because it's fun. Because you're a good girl.
You have to leave. So
Oh, thank you. I love you. I'm very lucky to have these girls. Where's my little kids? I know.
They're great.
we have this crazy thing going on this next weekend that we haven't even told like the Popaholic community because we're scared too. So we haven't. I think Erin did on hers, but I didn't do anything on mine. Okay, these are doing this now. Let's do these.
It would be too much on yours.
I think so.
Oh yeah. Yeah.
Because I mean, it's not meant for Popaholics really. This event,
they'd blow it up. Yeah.
Oh, and I can say this now. I can say this now because this is gonna be published after this, but or I can leave this part out. But 2 days before that, we're having a really special YouTube guest, actually. Somebody who's followed me for a long time that's actually very well known on YouTube. I don't know if your kids, I bet your kids know who this person is. So it's a secret. You can tell them, but don't let them publicize it. I don't think they would.
No.
Her name is Nikki from Nikki Tutorials. I don't know if you know her, but she is a big makeup guru, and she did this one really famous video called The Power of Makeup, right, girls? That's the name of it? That's the most popular one, that she did makeup on one side and how it transforms you. And she's really like a very girl power kind of person. And
definitely
yeah, really like, empower ourselves and be, make ourselves feel beautiful. And I think she's like a really good role model. And she's coming in from Amsterdam.
What?
Yeah, she lives in Amsterdam. She travels out here because she has her own makeup line now with Too Faced.
Wow.
So she's one of the big stars on YouTube.
Yeah.
And she loves popping. She started following me from pretty early on. Good. I'm just going to do this last few and then I think I can do it.
Okay.
Thank you.
A couple minutes past 12:40 right now.
Okay, I'm going to do these real quick. Pinch here,
Did your
pinch.
party on,
Well, she's not going to be there to this, but she's going to be she's coming like 2 days before. We're going to actually do a couple things with her. She's going to send me to Ipsy. She's going to take me to Ipsy Studios.
So excited.
Have you heard of that place?
Yes.
Oh, okay.
My girls get the Ipsy.
Yeah.
Yeah.
She's part of, so she's going to take me there and she's going to do a makeup tutorial on me.
I can't wait.
Teaches me how to do something. And then you guys should have questions for her. You girls, because I'm not going to open it to everybody because I don't want people like coming over here and stalking us. She's more popular than I am. I'm sure she'll get people showing up at our office just hoping to see us. But I think that you guys have a particular question for her.
I'm
You
sure
guys should ask
Chris,
us. I'm sure
your
Christy-
mom. You should bring your mom.
Oh my God, your mom will probably be stalking us. Actually, your mom will like show up.
Excited.
She'll be like, "Oh, was this today? Hi, honey, I brought you lunch." You'll be like, "I brought you lunch." You're like, "We never bring her lunch." She'd be like, "Oh, this is today." I could totally see her. She loves her, huh? What does she love about her? She just loves her personality and she gives her makeup tips?
I can feel that.
Oh, I'm sorry.
Okay.
That one was a little pinched, a nick, but I don't think you're gonna feel this part, right? This one's okay? Questionable?
Yeah, I still feel that.
Those two, let's go quick. I'm gonna do this quick. Quick, but without pain.
She has really good makeup tutorials.
Yeah, that's it, right?
She
She's really good.
does, yeah.
So like I can learn from her for real. Like this is not just like playing around. This is like real, like teaching me how to do things.
She really is.
How about like Jeffree Star? Is he really good too, or he's more like
different.
a
he's good
figure,
too,
like a?
But
This is the last one, I think. Last one.
I think he's been doing it a lot longer than she has, definitely.
Oh, okay.
But because she's younger,
Yeah, she's 22, right? Did you
Oh my goodness, she's a baby.
I think somebody said she's 22.
She is a baby.
I didn't know she was that young.
Yeah.
So that's really great
Her
that she.
name's Nikki, and what's her?
Nikki, I don't know what her last name
No, what
is.
did you
Oh,
say
Nikki Tutorials is what she
Her
is.
famous.
That's her name of her YouTube channel.
And it's on her Snapchat and her Instagram is all the
Yeah.
same. Nikki Tutorials.
Okay.
Nikki with an IE.
Okay.
If you ever wanted to know, I follow her on my Instagram. I don't follow a lot of people, so you could find her there too.
Okay.
Like if there's only like 45 people or so that I follow. I also follow Christy, but it's private, so don't try to follow her. I just say that to everybody.
You can try.
And she won't
Okay,
say yes.
stalker.
Well, you have to make sure they make a certain cut before you accept them. What do you mean? You're picky.
Well,
You're not going to say yes to anyone, I would
no,
say.
I
Unless you
keep
knew
it
them.
strictly people that I just know.
Yeah,
Yeah.
of course.
People that
makes
I've known
sense.
for a long time, like my family. My very close friends I consider family.
You okay here?
Yeah.
Okay, just we can get that last. It's like still coming out of the side here. What the heck, guys? That's when it gets in. Look, what the heck? I thought I got it all. Oh, more.
But that one feels deep.
Yeah, actually it does. I feel a little,
No, I can feel it
a
when
little
you're
area
squeezing it
underneath.
because it feels bruised. So I know that there's more in there. That's why I can.
Oh, really? This one might, if anything gets inflamed, it might be these kinds that do. You know, because it's like underneath. I can't get to the bottom of it. Okay, last little bit. I'm gonna put scissors and then. Thank you for staying.
Yeah.
And then we got to take a picture of her with that on her. That one, I'll put that one later. It's okay. It's long because that one's pretty good. This one too.
Oh, and just for the record, there is a couple people that don't understand, and that's probably why they're there to watch, but also to get educated. Is sometimes people say things like, "Oh my goodness," like I'm not clean. Because,
Yes. No,
and
but
it
they
has-
say that for everything
Well,
that we
right.
do.
Well, but the
that's
thing
not
is,
true.
and it's so cute because other
Oh yes, they
subscribers-
jump on them.
Yeah,
right?
they'll come to my defense, and the thing is, it's not because you're not clean.
No, it's not.
It's a condition. It has nothing to do.
Yeah.
You can't help it.
I think I need to leave this one open actually though, because I need it to come out. You know, I don't want it to close. It's a little slit there. Okay, let me get your little pass there.
My little note.
Yeah, your little note. There's something under there. I know that. I feel
I'm
it.
sorry.
One more. My neck. One more time. Just it's not right here, but there's something here. Where is it? Ah, it's right here. I feel something here. Make sure I'm not hurting you. What the heck? Girls, I don't know where I feel it either. I don't want to keep pushing on her. Oh wait, here. It's actually there. We go. Look, oh, I got it. I got it. I need to pick up though. Okay. Oh, I think the whole thing came out right there, in the sack. Maybe it's here. There we go. Look, it's like I can see it actually. Do you see that?
It's like a deep tissue massage
It's
on your
like-
tush.
It is
I honestly
literally
fall
a deep
asleep.
tissue massage or
So
something.
amazing.
I think I got it. That was much better. Okay, that's fine. Okay, that's much better. That's okay. So, let's